Hi there, I hope you're doing well today. There's a lot happening in the world right now, but one topic that really stands out is healthcare. If you've been following the news, you've probably heard about some of the changes Donald Trump's administration might make during his return to office. These changes could impact everything from your health insurance to prescription drug costs, Medicaid, and even how certain medical services are regulated. It's a lot to take in, but here's the thing, it's also something we can prepare for. Today, we're going to talk through what these potential changes might mean for you and your loved ones and what steps you can take to protect yourself. To start, let's talk about the Affordable Care Act, or as most of us call it, Obamacare. Right now, this program helps provide healthcare coverage for about 45 million Americans, including many low-income families and people with pre-existing conditions. Trump has made it clear he wants to make changes to the ACA, but here's the catch, he hasn't given much detail on what those changes might be. During his campaign, he mentioned having concepts of a plan that would be better and less expensive, but his track record tells a different story. In his first term, Trump supported efforts to repeal the ACA entirely, which would have left millions without insurance. So what could happen if these changes go through? One of the biggest risks is to people with pre-existing conditions, things like asthma, heart disease, or even pregnancy. Right now, the ACA requires insurance companies to cover these conditions without charging extra. If Trump's administration rolls back these protections, it could mean higher premiums or even losing coverage altogether. Imagine having to choose between paying your mortgage or affording life-saving medication. That's the kind of dilemma many families could face. Now, let's shift to Medicaid, a program that provides healthcare for low-income families. Over 72 million people depend on Medicaid, but Trump's past actions suggest he might try to cut funding or make it harder for people to qualify. For example, his administration previously proposed adding work requirements for Medicaid eligibility. While this might sound reasonable at first glance, studies show that these requirements often create barriers for people who are already struggling. Think about someone juggling two part-time jobs who still doesn't meet the requirements because their hours fluctuate. These policies can leave people without the safety net they desperately need. And it's not just Medicaid. Medicare, which serves older adults and people with disabilities, could also see changes. Trump has promised to protect Medicare, but some of his proposals might increase out-of-pocket costs for beneficiaries. For instance, the Inflation Reduction Act, passed under President Biden, helped lower prescription drug prices for Medicare recipients. If those measures are renewed or are rolled back, seniors might see their medication costs skyrocket. For many retirees on fixed incomes, that could mean tough choices about how to spend their money. Speaking of costs, let's talk about prescription drugs. One of the most significant healthcare challenges in the U.S. is the high cost of medications. The Biden administration introduced policies to negotiate drug prices, but Trump's administration might take a different approach. While he's suggested he wants to lower costs, his previous actions have included policies that favored pharmaceutical companies. So if you rely on expensive medications, now is a good time to look into cost-saving strategies, like using discount programs or exploring generic alternatives. Another area we need to discuss is reproductive and gender affirming care. Trump's administration has signaled plans to restrict access to abortion and gender affirming healthcare. For example, Medicaid currently covers certain reproductive health services in many states, but federal policies could change that. These kinds of restrictions don't just affect the individual seeking care, they also impact families, communities, and even employers who provide health insurance. It's something that could ripple through our entire healthcare system. Now, let's talk about what all this means for the future. Changes to healthcare don't just happen overnight. They often require new legislation or policy adjustments, which can take months or even years to implement. That means there's still time to prepare and adapt. But preparation starts with understanding what's at stake. Whether it's keeping up with news about policy changes, reviewing your current insurance plan, or even exploring new coverage options, staying proactive can make a big difference. So what can you do today? First, take a close look at your health insurance. If you're on Medicaid, Medicare, or an ACA marketplace plan, pay attention to any notices or updates about your coverage. It's also a good idea to familiarize yourself with your plan's benefits and out-of-pocket costs. If you rely on prescription medications, talk to your doctor about ways to save money, like switching to generics or using mail-order services. If you're employed, check in with your HR department to understand how potential changes might affect your employer-provided insurance. And if you're uninsured, now might be a good time to explore your options. Many states offer low-cost or free clinics that can provide basic healthcare services, so don't hesitate to reach out for help. One thing I really want to emphasize is the importance of community. Changes to healthcare policies can feel isolating, but remember, you're not alone. Whether it's joining an online support group, talking to a local advocacy organization, or simply discussing these issues with friends and family, staying connected can provide both information and emotional support. Before we wrap up, let's take a moment to reflect on why this all matters. Healthcare isn't just a political issue, it's a human issue. It's about ensuring that you and your loved ones can get the care you need without going bankrupt. It's about protecting the most vulnerable members of our society and creating a system that works for everyone. So as we navigate these uncertain times, let's commit to staying informed, asking questions, and supporting one another. Let me know in the comments or share your own experiences. Together, we can make sense of these changes and figure out the best path forward. Thanks for joining me today. Take care of yourself and your loved ones, and I'll see you next time.